This is Impact Healthcare.
Attention. This podcast has been disrupted.
Welcome back to another episode of the Disrupt Healthcare podcast. And I keep wanting to say Impact Healthcare, but we changed the name. And if you're a loyal listener or you're just looking at the cover of the little icon, little page, you're going to see that Disrupt is spelled with a Y. And that is very intentionally done because we kind of got tired of hearing, the status quo continuing to go over and over and over again because people are more worried about what's in it for me, the I. And so we wanted to make sure we built this business, this brand, this podcast to articulate the why everybody's doing this. And somebody I know, I've actually never met him live, but we're LinkedIn buddies and I know he's a good dude and he is every day waking up talking about the why. Mr. Dean Jargo, give us an introduction to you, your great company, and let's have a good conversation.
Yeah, well, Lester, thanks for having me again. As always, glad to be back with you. I'm actually a finance guy by training. I spent 30 years working in CFO and finance roles. I got involved in healthcare like many people, not because it was my plan, but because I saw an opportunity to get involved, and it was something I was passionate about back in 2017. I'm also a free markets guy. I believe free and competitive markets are the best way to deliver products and services that people value. So I saw healthcare, and being a free markets guy, I saw a big opportunity because I don't see, generally speaking, free markets operating in the U.S. healthcare system. So I thought, well, let's see if I can bring some of my passion in that area to the space as well. And then I actually got further involved into healthcare because 3 years ago, my wife got diagnosed with breast cancer. And in the middle of a breast cancer treatment, which would involve surgery and chemo and radiation and hormone treatments and all the things that go with it, a week after her breast surgery, she found out that she had a mass in her heart that required a mostly emergency surgery, open heart surgery, to deal with the mass in her heart. And so I got plunged into the health because my wife and I and my family were overall healthy. We deal with the healthcare a little bit, but we got plunged deep into the healthcare system, and so we saw some things that we didn't understand, being mostly healthy people. And so that exponentially increased my desire to, be a part of fixing what everybody would say. There's part of the group that works in this space that says healthcare is broken. There's the part of us that say, well, no, it's not broken. It's working exactly as the powers that be have designed it. And I believe both are true, right? It is both of those things. It is still broken though. And so, yeah, that's me in a nutshell.
So your great company that you started with, the lens that you have, tell us about what you guys do and how it values.
Yeah. Yeah. So fair market health, and when you hear that name, you're supposed to think of free market health, and everybody wants to pay a fair price, and a fair price, really is both for the buyer and the seller, right? We're not trying to get to a price where one has a significant advantage over the other. So the name fair market health is supposed to accomplish that thing, and that thing is bringing together buyers and sellers of healthcare services to transact directly. We all are accustomed to buying or accessing healthcare services through these things that are called insurance networks. And as we have learned over the last 20 plus years, insurance networks are not the friend that we all assume that they are. And it turns out that if you actually create more of an open and accessible and transparent market, it ends up being fairer not only for the buyer, which we know as patients and employers for the most part, but it also ends up being fairer for the seller of those healthcare services or the providers of those services, doctors and independent imaging centers and mental health therapists and physical therapists, all the people that provide the healthcare services that we need. When they sell direct and when people buy direct, i.e. not through insurance networks, everybody gets to win.
So Dean, we take for granted, since this is what we talk about every day, that what you just said is plain English. But I want to dissect that because I don't think the average person who's hearing our voice that's not in the business even has 2 ounces of thoughts around, well, wait a second. Who decided how much that imaging service is? So let's just play with an MRI as an example. Just to, kind of lay a level set for everybody. In the world that most people are in, who decided and how was it priced, that cost of that MRI?
Right, right. So in a traditional insurance model, what happens is an insurance carrier and slash network operator gets in a room and negotiates with the healthcare service provider, and for the most part, that typically entails a large hospital health system, and we're talking, thousands upon thousands of employees employed by these large health systems, and every city has at least typically one or two, sometimes up to three or four. But that insurance carrier and that large health system are sitting in a room, quote unquote, negotiating a price. But here's the reality that I had to learn the hard way is that what really happens is the hospital system, who is, even if they're a nonprofit, meaning non-tax paying entity, at the end of the day, they are trying to put money into their bottom line. They're no different than any other business out there, right? And so what they're asking for isn't necessarily or inherently wrong, right? They want to be paid more for the services that they provide. The problem with our U.S. healthcare system is the person who's sitting in the room supposedly on the other side of the table, the insurance carrier, supposedly negotiating on behalf of patients and their employer and clients, isn't actually negotiating on their behalf. They are operating out of their own self-interest, and their own self-interest, because of the way the insurance industry works, at least on the healthcare side, they actually make more money the higher the cost of those services. And so this charade that there is a negotiation taking place between the insurance carrier supposedly operating on our behalf and the healthcare system is absolutely and 100% false.
So I want to dig into this because I love this conversation. But Dean, take yourself back. You're an educated financial steward, right? Like you are a CFO of an organization. Before you jumped into this, did you have any idea that this was the case? That's number one. And then number two, in regards to that negotiation and the supposedly, I want you to dig in a little bit more of why you say that the health insurance company has no interest in actually lowering the cost of healthcare. Because I think when people hear that, they might not do that. So talk to me about those two sides of that conversation.
Yeah. So the answer to the first question, I had no idea. I, like most people, I think today, and it's understandable why they are living under this mistaken idea. I thought that the insurance carrier card that I carried around in my wallet, for me, it happened to be Blue Cross Blue Shield for most of my career, but you can apply the same thing to United, Aetna, Cigna, all the rest. I thought that card was essentially a discount card. I believed the lie I was told that convinced me that, hey, the insurance company has gone out and negotiated absolutely the best prices on my behalf. And so I thought, no, well, actually, I thought number one, if I don't have this card, I can't even get services. So number one, it's an access card. It's a get into the amusement park card or the healthcare provider. I had to have it or I couldn't even get the service, which, by the way, is also false. And number two, I thought it was a discount card, which I did learn over time through working closer in the healthcare space. That is absolutely not true. Now, why isn't it a discount card? The reason it's not a discount card is ultimately insurance companies make money off of premiums. They're in the business of charging companies for charging premiums and assuming risk. And part of the risk that they're assuming is they're saying we're going to pay your health insurance claims for the premium that we collect. Now, I'm not going to go too far into the weeds here, but there are laws that have been passed that cap insurance carriers' profit at depending on the size of the client, 15 to 20%. And so what happens when you cap a company's profit percentage? Well, the only way they can increase that profit as an absolute dollar amount, since the percentage is capped, is they have to grow the size of the pie. And what that means in the health insurance context is they have to pay out more in claims to justify collecting more in premium to make that 15 to 20% a bigger slice of that overall pie.
You explained it super well, and I want to make sure people understand. If you are listening to this and you are an employer or even a consumer of healthcare, you are paying premium to an organization who calls that revenue, and nobody wakes up in the morning wanting to lower their revenues. That's number one. Number two, you would think, well, wait a second, if I made everybody super healthy and I took in $1 of premium and I only paid out 60 cents in claims, that they get to keep that middle. They do not get to keep it. It's called the minimum loss ratio rule. It was invented during the ACA Obamacare. It was an unintended consequence that, to Dean's point, creates a scenario that if you are an employer or an employee of an employer, or if you are an insurance advisor, listen to this factually, you will never win staying in a fully insured arrangement. It's not pontification. It is not a guess. It is factual.
Yep.
Now, Dean, you said access and discount. You said, hey, I didn't know this as a CFO. And so otherwise very intelligent people who are managing strictly the P&L of this organization are being told by people, there's really nothing you could do. Just take your renewal increase and blah, blah. Now you flip over to the side. You start opening up the kimono. What surprises you the most as a free market, fair price kind of guy? What surprises you most when you start opening up the kimono?
I think number one, how actually easy it is to do it a different way. I think part of the fallacy that exists in the market is once you get over well, you can't do it any other way, right? So as soon as you realize, no, there is a better way to do it, the next lie that you'll be told is how difficult it is. And I think that's an absolute fallacy as well, because the reality is there are, and Lester, you know this better than I, there are literally hundreds of vendors out there that have existed for long periods of time, providing the assistance and the solutions to deliver all of the services that any partially self-funded plan sponsor wants to implement, right? There are independent TPAs. There are independent ways to access care, direct contracts, RBP, et cetera. All the tools exist. You don't have to become an expert in any one of those or execute any one of those overnight yourself. There are quality, transparent, fairly priced partners out there who are ready to serve any employer or plan sponsor that wants to go partially self-funded and do this in an entirely different way.
What's crazy about what you said about the fallacy of, like, the marketplace making it seem hard. I was advising an employer client who used one of the very large consulting firms. And so in the analysis that was provided for their renewal, they said, yeah, there are these other options. And then there was a line item that said cost of change. And so it applied a fixed cost in that calculation, the equivalent of a fixed cost, to the more innovative models that I want to dive in with you to, and then lesser to zero numbers staying in the status quo. And so I'm in this meeting. I'm being paid, by the way, by the employer to sit down on their side of the table. And so I looked over to the HR professional and I said, "Hey, Michelle, um, if you just renew with XYZ carrier, is this a busy time for you?" She goes, "Yeah." I was like, "So do you travel around to all of the locations?" Like, "Yeah." And you print out booklets and you do all this stuff. "Yeah." So would it be fair that doing nothing has a cost to it? And she's like, "Yeah." She was like, "I was noticing that like, blah, blah, blah," and like the broker, like, "Oh my God, that's not what we meant, blah, blah." But it's crazy when you think about people are putting numbers to making that change as if what we have today is working like a Swiss clock.
It's one of my biggest pet peeves, Lester. The word that gets thrown around so much in this space is disruption. And they treat disruption like it's something to be avoided, right? It's like, "Oh, no, you gotta stay with the status quo because you don't want disruption," and it's like, "Are you serious? We want disruption. We absolutely your employees are begging for disruption, right? You're looking at a 10+% increase, most of which you're gonna pass on to them. You don't think they want some disruption? They are begging for disruption."
You know what's interesting too when you think about it, and you just boil it down to like, let's get out of that. You and I are nerds in this business, right? Let's just like we're sitting having a beverage of choice, and we have a conversation about buying a car.
Right.
The days of Dean gets into his car, drives to the dealership, not having studied anything, goes in, buys a car on that same day. I can't name a story that somebody in the last 10, maybe 20 years that somebody has done that. And we sit here and think that the average consumer doesn't want to shop, doesn't want something different when the average consumer is going on this site and this site to shop for a car or a TV or the cell phone.
Exactly.
And we think it's and they're sitting on I always say this, I'm like, you have employees sitting on the ground cutting coupons out, and you don't think that they would like another way? It's unbelievably crazy. So we've been talking and hinting around this other way. Talk to me about what this other way, what makes this free market and this fair approach. What is it?
Yeah, I think a lot of what it is just what you said, Luster. It's removing the complexity actually that exists in the current system, right? In the current system, you as a patient or a buyer of healthcare services, you have no transparency into what anything is going to cost uh, prior to or at the time of service. You're taking it on blind faith that ultimately you're going to be able to afford this thing, because you can even ask the person, "Hey, what will this cost me?" And of course, what answer do you get? We don't know. It depends, right? We don't know because it depends on what your insurance network is going to pay and reimburse. And that's a terrible way to buy anything. So number one, let's start by putting the price of services up front. Now, most of the clients that we work with, employer plan sponsors, actually waive the out-of-pocket for their plan members because they want them to access the healthcare services that they need. I don't know the statistic, you probably know it, Lester, about the number of people that are avoiding healthcare services because they either know they can't afford the service or they are afraid they might not be able to afford the service. So if the principal reason companies are offering benefits in the first place is to help their employees be more healthy, that's a major fail. Right? I mean, fail right out of the gate. It's like if you're offering benefits to accomplish that objective, you are not therefore accomplishing that objective for, I think the number is like a third of the people, just avoid healthcare, either avoid their meds or avoid whatever other healthcare services they need. So, shame on us that we're not helping people either know the price up front or even better, avoid paying that price up front because again, when you buy it direct, it becomes a lot more affordable and it's a lot easier for the employer to just say, "You know what? I got this. I'll pay the whole thing."
So I want to unpack that. And I believe the stat is 43% of
Even higher than I thought. Wow.
have skipped or delayed accessing healthcare because of cost. So I wanna come into this because quite honestly, I think I'm halfway smarter than the average bear, and I would tell you like this didn't click for me until I was actually able to see both sides of the fence. So over here, we typically are looking at health insurance claims and things of that nature. And you don't ever get all of the data to kind of understand. And then as I started to consult for some hospitals, I started to see their collections and all this. So let's run this down. A hospital bills at this because they got to give a discount at this. They give a discount at this. They now have an allowable charge here, but then the patient responsibility has all of this. And but by the time they have 60, 90, 120 days to get paid for by their carrier, and then they're chasing the money from the patient, and the average patient can't afford it. And then you have all of the stats of healthcare debt that one in every whatever, and 67% of people file personal bankruptcy, blah, blah, blah. At the end of the day, the hospital has to bill this in order to actually collect this. So what you're saying is, hey, why did we take 17 detours to get to grandma's house if we could just have a conversation and go to grandma's house?
That's it. That's it.
And here's the crazy part. And I need everybody to listen to this. When I said it out loud the first time, I sat back in my chair and I'm like, wow, it took me 19 years in this business. This was a couple of years ago. 19 years in this business to say this. What we call a deductible and out of pocket on the insurance side, the healthcare side calls that an accounts receivable.
Yep. Yep.
And it was crazy. So now you're saying in your world, hey, seller of services, hospital providers, whatever, you're going to tell us a fair number. Hey, cost you $1 to perform the service. There's going to be some sort of, and we want you to make a margin. We're capitalists.
Yep.
You buyer of service, employer, you're going to pay a lesser number than you did when the whole gamesmanship is happening. And I'm also not going to make you, hospital, chase these dollars so the cost to collect comes out.
Yep.
The triangle of people, the hospital wins,
Yep.
the employer wins, the employee wins.
That's it.
Why aren't more people having this conversation?
I think on the hospital side, and I don't want to be too disparaging here because sometimes I think, well, did the hospital decision maker skip economics class? Because and there's actually a third leg to the stool you described, Lester. It seems most hospital decision makers are very focused on revenue. What's one of the least important line items on your P&L? It's actually revenue, because at the end of the day, what drives business, right? It's net profit and cash, right? And so that's the real number we should all be focusing on for our businesses, hospital systems included. And so, that revenue number that they seem very focused on is missing the two things you said. Number one, the write-offs that they're having to take through insurance networks. Number two, the cost of collecting that bill, which is, I think, 25-35% is not out of the ballpark of what they're actually incurring. And the third piece that they forget about is a little thing called time value of money, right? If I can collect $1 in 5 days versus collecting $1 in 5 months, which dollar is more valuable? Of course, the dollar that's collected in 5 days. So you lay in, I don't have to take write-offs. I don't have to incur a lot of collection cost, employing people that sit in buildings and use computers and all the cost that goes into that. And I get paid faster, meaning I have, that dollar today being worth more than the dollar 5 months from now. Factor all of that in, and suddenly just cutting clear, direct, transparent deals with buyers of healthcare services becomes significantly more attractive.
What's crazy about that is that's all math, right? That's just arithmetic.
Yep.
And going back to what I think fires the both of us up is we just made it better for the consumer of healthcare, the patient, and that community. I mean, how many times, especially in this business, can you have a conversation with everybody in the food chain, right? The entire supply chain, and say, "Hey, if we come together and have this conversation, everybody will walk out with a win." And the one of the largest employers in every market is the hospital. People in that, they all have in their mission statements and their credence, like, we want to improve the health of our population. Meanwhile, over here, deductibles are at a rate that people can't use the plan. So it's like these two things don't match. So there is an inherent, like, practice what you preach that goes into this, that is, I think, what will separate when we think about the adoption curve, the early adopters, and on that side is going to be, yeah, the math works kind of, but like we know it works in this old model. There's going to have to be but this is the right thing to do.
Amen. Well, and think about the other side of it as well, Lester. Okay, if we get to a world where an employer plan sponsor can afford and be frankly very happy about waiving their employees and plan members out of pockets, so they then can access the healthcare services that they need. Think about the other thing that gets avoided, all the invoices and EOBs that show up in the traditional system after the service has been delivered. You're at home, you're trying to recover from your cancer surgery or your cancer treatment, and you're opening up bills that you don't even understand. And I challenge anybody to ever understand any one of those bills or EOBs that comes out in the mail. So you've now piled on this whole other layer of stress while the plan member, your employees and their dependents, are trying to recover from the healthcare service that they procured. And so it's just another advantage of just buy it direct, buy it simply, transparently, and you get to avoid all that other downstream noise and nonsense as well.
So, Dean, when you have this conversation with both the supply and the demand side, let's go the supply. You're sitting down with a hospital executive. Talk to me about how that conversation goes. What are the questions that you get, and friction points, all of that stuff?
Yeah, I think the number one friction point is, as I said, I think they get very myopically focused on the revenue number, right? They just compare, hey, $1,000 is more than $700. I want $1,000, and they have this idea that insurance networks are going to deliver them the $1,000, but they forget, no, by the time you take out the bad debt expense, the cost of collection, the time value of money, you're actually only collecting $600 versus the 700 you could have gotten had you just done a direct deal with the true buyer of the healthcare service. So to me, it's all about revenue focus and myopathy, and that is to me the main problem on the hospital system side of things. I guess I'd say the other thing, because we do even work with a lot of independent practices, meaning not hospital system related, and a lot of times we're talking to an administrator who just grew up in the insurance world.
Right.
They
They don't even know that
fundamental. It's the only way to operate. They have like, you bring this idea of, no, I can just pay you directly and quickly, and they're like, I don't even know what that means. I've spent 25 years in insurance and revenue cycle management. I don't want to learn a new way. This is the way I know how to do it. And that shuts down a lot of conversation.
It is so crazy to think, like, I could pay you cash. Like literally, like, I could just pay you directly. Is like, wait, we don't take that.
And the crazy part is the physician who's sitting in the back office, if he had or she had any idea, they'd be like, take the cash, take the cash.
Right.
But they don't know. They're not up at the front desk, right?
So flip that conversation. Now you're with the CEO, CFO, VP of HR at an organization. You have this conversation. What's the friction point? What's the education there? Well, what does that conversation look like?
Well, I'd say first, Lester, and you know this as well as I do, a lot of times the CEO, the business owner, they're not even in the room. They've delegated this decision either because they don't want to be bothered with it, or they don't think they've got anything to add, or it's confusing and they don't want to mess with it. So they have pushed the decision in further into their organization. Typically, it lands on the desk of a very busy HR professional who, by the way, didn't get into HR because they were excited about running and managing a health benefit plan. They got assigned the task and they're doing the best that they can. And unfortunately, they're just not getting much help, right, from someone like the CEO or the CFO who have skills that they could bring to the table, either in terms of setting vision or risk management, analytic capability, a long list of things that they could bring to bear. But unfortunately, in too many conversations, HR's been left on an island on their own to figure it out. Which, what does that mean? Typically, that means they go out and hire the big benefit brokerage firm, right? Because they've got a reputation, right? The old nobody ever got fired for hiring IBM. It applies absolutely in the health benefits space. So that means the decision has now been delegated even further. And now outside of the company. And what nobody bothered, or too few bother to ask, is, are we financially aligned? Are our incentives financially aligned? Too few people are asking that question. So it's this two-layer delegation: CEO typically to HR typically to misaligned benefit advisor, and everything that happens after that is a direct result of those two decisions.
And Dean Jargo, X number of years ago, the CFO of this organization, you knew very little of what you just said was going on.
I am guilty of what I just described. I am at 100%. I'm pointing the finger back at me, and talk openly about it because I don't want other CFOs and CEOs and business owners to make the exact mistake I made for a 30+ year career sitting in the C-suite, because it's a mistake that doesn't need to be made. This grumbling that is taking place about the high cost of healthcare. It's like, hey, C-suite, look in the mirror. You have control over this problem. This isn't a government problem. This isn't an insurance carrier problem. This isn't a benefits advisor problem. They all contribute to the problem, but you have control over the problem.
Very, very good way of saying it. So I want to end with your advice to those people, but you showed us a different way. Now unwrap that and say, what are the results? Like, what are the results? Like, are we talking about a couple of bucks of savings? Is this a material saving? What is this new way of looking at things? What does it yield at the end of that rainbow?
Yeah. So we do, this, but for your listeners, we do something called a claims analysis, right? We will look at historical claims, de-identified, meaning it's totally anonymous. I don't need any personally identifying information to do this, but it's like, hey, just show me over the last 12 to 24 months, what did you actually pay cash for all the healthcare services that your employees and their dependents have consumed over the last, year to two. And I will effectively reprice that from the way you did buy it through a traditional insurance network into a pro forma. What could you have paid had you just purchased it directly? And the savings, of course, it depends on the size of the spend in the first place, but typically as a percentage, on an individual transaction level, it works out to about 35%. So if you spent, $50,000 on a knee replacement, you could pretty comfortably assume you're going to pay somewhere around 35, probably even 45 to 50% less had you just bought that service directly, not through an insurance network, meaning working directly with the provider of that service. Now, what does it mean as you roll all the way through your spend? Because some services are very difficult to purchase directly, right? You're not buying ER services
Right.
directly, right? You're paying the bill that shows up for most ER services. So when you get to the bottom line, total healthcare spend, you have an ability to impact somewhere between 10 to 20% of that number. You'll save 35 to 45 at an individual line where you can buy direct, but the net impact all the way through your health plan, somewhere around 10 to 20%.
So let's just take the midpoint and say 15%. And that's 15% while giving that patient a free service,
That's it. Yep.
while paying the provider a fair, reasonable, and quick payment.
Yep.
So this isn't stripping benefits. This isn't passing on costs. This is, I'm just changing the way we finance things and
That's it.
buying it more direct.
And one important point I'll add quickly is what happens when providers figure out there is a way to be paid quickly and easily without all these insurance hassles and headaches that they deal with. As soon as they figure that out and that light bulb goes off, then they tell their scheduler, hey, when you get patients that want to pay me cash and buy direct, put them at the top of my schedule. And think of how important that is. My dad right now is waiting 2 months for an appointment with a rheumatologist. And that is going to become more and more the norm, especially for people walking around with these insurance network cards. And if you have a way to buy it direct, you are going to move to the top of the line as a patient. And man, is that important.
That is amazing. So, Dean, I want you to think in the room, this virtual room that we're in, that you have a bunch of your old colleagues, CFOs in the room. What's the one thing you tell them to do? Now that they heard this, what's the one thing you tell them to go do?
I mean, I'd say at a high level, I'd just say get engaged because I don't think, as I said, most of the C-suite is actually engaged. And I speak particularly to the CFOs, right? I think CFOs, and obviously I'm biased, but I think CFOs have a lot to offer to the benefit plan space. They're good at risk management. They're good at procurement. They're good at financial analysis and data analysis and a whole host of skills and capabilities that actually bear a lot of fruit when they're applied to a health benefit plan. And by the way, I'm not talking about kicking the HR person out. I'm saying get there and be part of the team, be a collaborator. There is a massive ROI sitting inside every company's health plan. And, a lot of companies are out trying to figure out how to enhance sales and, that's all fine. But I'm willing to guarantee most CFOs and business owners, the highest ROI opportunity sitting in your P&L right now is your health benefits plan.
I literally made this calculation yesterday for somebody. It's a fairly large organization that we could save $3.5 million. And I was like, at your current, I mean, at least what I see on the internet, net margin perspective, you would have to sell $25 to $30 million in sales to do what I can do just on your prescription drug program.
And the crazy part about it too is it's 100% in your control, right? To go sell another $50 million of widgets, that's not in your control. You got to go convince somebody else to say yes to that. This is all 100% in your control.
It is a very good point. Dean, if somebody wanted to seek your counsel, learn more about what you guys do, where can somebody find you and find out more information?
Yeah, LinkedIn's the best way to find me, Dean Jargo. My email's there as well. Website's there. So, yep, LinkedIn's a good resource.
Awesome. Well, Dean, if for the rest of the audience, any parting shots?
Again, get engaged. The opportunity is huge. It's not as hard as some people are trying to convince you that it is. Just get engaged. There's money laying on the ground ready to be picked up.
I agree. Well, thank you, Dean. This was a great conversation. I think I could talk to you all day about this. So thank you so much for being a guest. For our listeners out there, when you think of the why behind this, I want to take a step back and remember how we started the conversation. There are literally people sitting on the ground cutting out 39-cent coupons for lima beans. Meanwhile, people that are in high positions are stepping over dollars because they just don't know. So if you could do me, do Dean, do the industry, do kind of the U.S. economy a favor, Share this with somebody who needs to hear it, a CFO, a financial steward inside of an organization, because we're going to get ready to, right now, it's busy season in our world. And this is already anticipated to be one of, if not the highest increase season that we've seen in years, with the cost of everything, tariffs going up already. The reality of it is this is getting to the point where this is going to break. And to what Dean says, we're all in control of making a difference. We just got to make that difference. So hit forward, hit share, make a comment. Dean, thanks again. For the listeners, thank you so much for helping me disrupt healthcare. We'll talk soon.